Hello again. This is Earl Silverman, Editor-in-Chief of the Journal of Rheumatology. Welcome you back as I highlight a paper of particular interest to the readership by interviewing two of the authors of an article from the September 2022 edition of the journal. The article I picked for a more in-depth exposure is entitled "The Association of Illness-Related Uncertainty with Mental Health in Systemic Autoimmune Rheumatic Diseases," and it's by Wallace and colleagues. Today, I'm pleased to be speaking to Dr. Daniel Hill and Dr. Zach Wallace about illness-related uncertainty in patients with rheumatic diseases. Tell you, this is certainly something I knew very little about before I read this very interesting article. So Daniel and Zach, I want to thank you both for taking the time to speak to me and the listeners. So let us begin. Could you tell me how the two of you got together this study, as it certainly is not a field that is commonly studied in systemic rheumatic diseases?
Yeah, I'm happy to take that first question, and thank you very much for inviting us to join you. This is really exciting, and we appreciate the opportunity. So, you know, I appreciate that comment because it's something that I think many people in the rheumatology space are somewhat unfamiliar with. Daniel and I are at Mass General in Boston, and we're privileged to work in what's called the Mongan Institute, which is an institute that brings together researchers from across disciplines doing a variety of different types of research, with the idea that by bringing us all into one place and within this institute, it will sort of feed this, you know, cross-pollination and collaboration. And there's been a lot of sort of efforts and enthusiasm to encourage us to work together. And when I came to Mongan, one of the things that I was working on at the time was developing an instrument for patients with IgG4-related disease to sort of understand their disease and their symptoms and the burden of those symptoms from their perspective. In the process of doing some qualitative interviews, we were seeing some interesting results that suggested that a lot of these patients were experiencing or describing uncertainty related to their diagnosis, to their treatment. And at the same time, you know, I think there have been a lot of studies in recent years describing, from the patient's perspective, similar concerns or experiences that impact quality of life in ANCA vasculitis and other systemic rheumatic diseases. But it remains something that was really not well studied. So I ended up connecting with Daniel when I presented some of the findings from our qualitative studies and sort of summarized some of the other data out there in the literature, recognizing that he and his group had done a lot of work in this space exploring illness-related uncertainty. In addition to defining it, also thinking about how we can address it and how we can help patients sort of manage it better. So that's sort of what brought us together. The fact that we were at the Mongan, I was doing this work, Daniel had expertise in this, and it was just a really neat way for us to kind of combine our expertise and interests.
Want to add anything?
That's great. I think Zach really said it all. I also want to express my appreciation for speaking with us today. And, you know, just to say, I think Zach and I both are very interested in collaborative work. And certainly there's a lot within the field of rheumatology that can be studied through a psychological lens. At the same time, a lot of what we know about psychological coping and resiliency can really be unique in different illness populations. And so through this collaboration, I was able to bring some expertise in the measurement of uncertainty and how we might assess that through a survey. But Zach and his team have brought a lot of expertise as well about the patient experience, common concerns, which has really made it a rewarding collaboration.
I'm shocked that stuff like that actually works. You get an institute that's supposed to collaborate, and it worked. That's fantastic. So it's really, actually, seriously, it's good to hear this.
Yeah, we're lucky to have a great director here who's really passionate about bringing us all together in new ways.
That's great. So a little more mundane, what were the specific aims of the study?
Yeah, I can take that one. So we had two, I think, broad aims. One was to determine first, or I guess a few. One was to determine, whether we could measure uncertainty in this population and how we could do that. So we used this instrument that Daniel might weigh in more on, but one that one of his former mentors had developed, and we were able to adapt it specifically for patients with systemic rheumatic disease. But what we also wanted to understand was, in addition to being able to measure uncertainty and characterize it in this population, we wanted to see how that influenced or impacted mental health. So that was the second aim. And the third aim was to understand what sort of needs our patients with rheumatic disease, what needs they had that were being unmet. And it wasn't just psychological needs. We actually surveyed about all sorts of different types of needs, whether they be financial, whether they be having to do with sexual function, but also their mental health needs and their mental health well-being. So those were kind of our three broad aims, and trying to understand how uncertainty wove through their mental health and also was associated with their needs. And so that's what led us to the study that you guys have published here.
Good. So to the people like me, how was uncertainty and its effect on mental measured? I mean, and just an aside, this really brings up a point sometimes when we get into a field that we discuss that is not in rheumatology per se, as Zach and Daniel know, is challenging to get reviewers who actually could intelligently review this. So I do apologize for the delay in the publications. Go ahead.
No apologies necessary. We're delighted to be published in Journal of Rheumatology. So just a bit about how we assessed our patient-reported outcomes. We assessed our surveys remotely and electronically using REDCap. And in addition to electronic completion, patients did have the option of completing surveys over phone or mailed, but predominantly they were completed electronically. We assessed their demographic information. We assessed rheumatological uncertainty using this 22-item measure that Zach introduced. It's called the MUIS, the Michel Uncertainty and Illness Scale, and it's published in a variety of versions. One of those versions is called the Survivor version, and it's meant for characterizing uncertainty among patients who are living with chronic illness, sort of in this extended survivorship phase. And higher scores reflect higher uncertainty. And so we adapted some of the language on the items that refer to uncertainty more generally to specifically say, answer the following questions with regard to the concern that you're treated for with your rheumatological illness with your rheumatologist. And each of the items were anchored to their experience coping with rheumatological illness. And if we have time, I'd be happy to share their 4 domains of uncertainty that are assessed on this 22-item measure. I'm happy to say what those domains are or share sample items from the scale. And well, I could briefly mention, one of those domains is ambiguity. And so this happens when patients aren't clear about their symptom course or explanation or treatment. And so we had an item that said, I am unsure if my rheumatology condition is getting better or worse. Okay, so just lack of clarity about that would fall under ambiguity. But there are other sources of uncertainty that rheumatological patients face, like unpredictability about the future course of their illness. And so one of the items that's reverse scored says, I can predict how long my rheumatology condition will last. And so that would reflect, again, unpredictability. There's complexity in navigating healthcare, okay, a common source of uncertainty. And a sample item that we had on the measure said, I see so many different types of providers it is unclear who is responsible for what. And then the final domain is lack of information. Sometimes this can be problem solved, like not knowing when your next visit is scheduled. And one item that we had on the measure said, it is unclear to me how I will manage my rheumatology condition after I leave appointments with my rheumatology providers. So we created a sum score, but you could look at individual domains, and we also published the measure, the adapted measure, in supplementary materials.
Great. I encourage people to have a look at it. Anything you want to add, Zach?
Yeah, no, I mean, I guess the only other thing I would say is that in addition to measuring uncertainty, we also intentionally measured and we're interested in understanding how it was associated with depression and anxiety and sickness impact, and used pretty standard measures for those things as well that I think a lot of readers will be familiar with.
Right. And so that leads really to the next question, the major findings of the study. Like to summarize.
So I can, Daniel, was I going to do that one, I think?
I think so. And then that's right.
Yeah. So so I could take on this one. So I think we had a few major findings from the study. The first was, as Daniel alluded to, we had adapted this instrument to use it in patients with rheumatologic conditions, and specifically we studied it in enrolled patients who had ANCA vasculitis, systemic sclerosis, or IgG4 related disease, and we had a nice mixture of patients with each of those conditions. And what we observed was that there was, a spread of uncertainty across those conditions. It did vary. It seemed that some conditions like systemic sclerosis and AAV or ANCA vasculitis were associated with more uncertainty than IgG4 related disease, which is interesting and probably requires some more thought and consideration as to why that might be. And I think, many of us can hypothesize what might be different about systemic sclerosis or its management compared to these other diseases and why those patients may have more uncertainty. But I think the second major finding, besides just the degree of uncertainty and the differences across the diseases, were the associations that we observed between uncertainty with depression and anxiety and sickness impact, really suggesting that while the relationships here are complex and anxiety and depression may influence the way we appreciate illness-related uncertainty and vice versa, what this does suggest is that those complex relationships do exist, and that there is this association between having greater amounts of uncertainty and experiencing greater amounts of anxiety and depression and sickness impact. And what that leads us to think about, and Daniel will get into this more, is that how can sort of targeting uncertainty in some way maybe improve the amount of anxiety or depression that our patients experience. And we did see that a fair proportion of patients did have, at least some depression and some anxiety, suggesting that, as we know, these are really important targets for our care moving forward. And then I think our last major finding was just the needs expressed by our patients. We've made tremendous progress, I think, over the last several decades in terms of our pharmacologic management of rheumatic conditions, with the introduction of, incredibly effective biologic and targeted synthetic DMARDs, as well as our more conventional DMARDs, and learning how best to use them. But while we've made those pharmacologic advances, I think what's perhaps been left behind a little bit is less progress in terms of addressing the other needs that our patients have. And those were expressed by many of our patients. Some of them included sort of managing their physical symptoms, things that may not be responsive to pharmacologic treatments that we use, like our immunosuppression. They expressed interest and need in learning other ways to care for themselves, care for do their activities of daily living and things like that. They also expressed needs for help coping with some of the emotional concerns, like the anxiety and depression that they reported in these studies. What we also found was that those needs were tightly associated with uncertainty. So the more illness-related uncertainty a patient expressed, the more needs they tended to have. Again, highlighting that there's a great potential here, I think, to address illness-related uncertainty, and that may affect not just their anxiety or depression, but what they feel like they're missing and needing in their day-to-day care. And I think those were kind of the main findings from our study.
Anything you want to add?
Well, just to piggyback off of, these results, I think they, lend themselves to thinking about potential next steps. I'm not sure if potentially you may be asking about that as well. But that's a big thing that we're thinking about, where do we take, given, the scope of these conclusions, because we did have, as Zach mentioned, 3 aims in a series of conclusions we've drawn from this. Where does that leave us? And our group is beginning to plan for some next steps. Happy to tell you a little bit
Yeah,
about.
please do. Perfect.
Terrific. Well, one clear next step for us would be a larger survey study. Although our sample size was large enough to draw some comparisons between, the 3 patient disease groups that Zach has, described, they were still relatively small sample sizes, and that did preclude our ability to, do more sophisticated modeling, and it was a cross-sectional survey. And so we'd like to do some larger surveys and some longitudinal designs with these same illness subgroups. But in addition, we're thinking about some potential implications for intervention development. It's one area of expertise in our background is within the Mongan Institute is actually developing resiliency interventions that address both physical health concerns as well as emotional health demands. And as many of us, probably know is, anxiety and depression and stress, they don't just live in the mind. They certainly, exacerbate symptoms, and they can be triggered by physical symptoms, and they can make physical symptoms worse and harder to manage. And so our team has developed some other resiliency interventions that have worked well in other patient populations facing chronic stress. And what we'd be very interested to do is try to translate that work. For instance, our work with cancer survivors and managing fears of recurrence could be translated through some formative qualitative work, integrating feedback from stakeholders, patient and clinician stakeholders, to design resiliency interventions that can be addressing both, again, physical health concerns and emotional concerns. The other thing that we learned from our survey is that patients were overwhelmingly interested in accessing these skills remotely and virtually. And I think that's an important consideration. This is consistent with preferences from other chronic illness populations. And we know in the COVID-19 era and since then that remote care is really the wave of the future. So we're designing interventions right now and planning some next steps to deliver virtual treatments to patients, and hoping to expand that work with more grant funding.
Great. Anything you want to add to that?
Yeah, no, if the NIH is listening, we'll be happy to. But no, yeah, it's very exciting, and I think we're looking forward to opportunities to start developing and testing some interventions to address some of these challenges that that our patients face.
Yeah, that's great. I mean, it's a good thing you guys are a lot younger than me, because this is like a lifetime work. It's one thing will lead to another. So.
Definitely. We're looking forward to our continued collaboration.
Yeah, that's
Absolutely.
fantastic. That's fantastic. So do you think there's anything maybe we missed you want to add that I forgot to ask you? I mean, this has been fantastic. I continue to learn after reading it and speaking to you guys. Anything you think for people like me that we missed?
I think we covered it all, but we're so pleased to be able to join you today. Thanks again for the invitation.
Well, you good, Daniel?
Yes, absolutely. I was going to say, hopefully we have future opportunities, to give you updates on our work over the coming years, and we certainly appreciate the chance to share a little bit about our findings.
Well, looking forward to it, and always remember us in your future work.
Definitely.
And think about maybe collaborating with people in Canada. So we are not quite the size of your country, but maybe a different perspective. And one thing that certainly struck me with this is not only is it longitudinal studies and see how it changes the intervention, is it center dependent?
Yeah.
or even physician dependent within a center. I mean, you wonder, those are things.
Definitely.
Every physician hopes they score better.
Yeah,
Right?
exactly.
Well, that's not me. So I do really want to thank you for taking time to really inform us about illness uncertainty in rheumatic diseases, and look forward to really hearing more about this in the future. And I invite our readers to please read the full-length article, The Association of Illness-Related Uncertainty with Mental Health and Systemic Autoimmune Rheumatic Diseases. And there's an accompanying editorial by Gwenda Simmons and Mary Fahohi from the Institute of Inflammation and Aging at the University of Birmingham, UK, and it is entitled Fear of the Unknown. Can we help individuals with systemic autoimmune rheumatic disease deal with uncertainty? Good question. Both are now available on the website at jroom.org. I'd love to hear your comments on Twitter at jroom or by email at manuscripts@jroom.com. And I want to thank you all for joining me, and hope you'll come join me again next month when I speak to the author of an article of particular interest I've selected from the October 2022 edition of the Journal of Rheumatology. Thank you.